Om Swastiastu, Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera bagi kita semua, Shalom Namo Buddhaya. Hello everyone, so we are from small group discussion B9, and now we want to explain our student project assessment that the title is The Use of Antibiotics and Hepatic and Renal Failure. And this is our student small group discussion member. And this is our outline for our student project. So first there's introduction, and then discussion, and then conclusion, and the last one is reference. Okay, start from chapter 1.
Okay, my name is Phoebe Escalante and my student ID is 200251169, and I'm going to explain about our background. So first, the antibacterial, or more commonly known as the antibiotic, is a substance that inhibits the growth and replication of bacteria or destroys it. Even though in some instances antibiotics are necessary, it can be a bit harsh on people who have renal or hepatic failure, since medication that are consumed is eliminated by the liver and kidney. Their dysfunction can alter the disposition of drugs. It affects the absorption, plasma protein binding and distribution, and also the elimination of drugs, which can lead to prolonged elimination of drugs that can cause toxicity. And our problem formulations are what antibiotics are related to hepatotoxicity and nephrotoxicity. Next. Our objectives are to provide a better understanding about the antibiotics that are related to hepatotoxicity and nephrotoxicity. And our practical benefits is to give a detailed explanation about antibiotics and its relation to hepatotoxicity and nephrotoxicity to medical student, medical lecturer, and or to a wider community to develop better writing in the future. And our theoretical benefits is provide in-depth information regarding how antibiotics can impact the kidney and liver, so it becomes a consideration factors in prescribing. Thank you. Next.
Hello, my name is Anagung Rawijatana Parawaksa with student ID number 20025111193. So I will explain about the chapter 2, where is the physiological alteration of people with renal and hepatic impairment and metabolizing drug. So the medicine are metabolized in kidney and liver. If there is a problem with the kidney or liver, it will affect the absorption, distribution, metabolism, and elimination of the drug. Renal failure affects the metabolism of CYP-mediated drugs, the production of CYP45 enzymes, and it can result a lack of response to the drug indirectly. It's also making patient more resistant to the antihypertensive effects. And then hepatic failure will result in pathological changes and changing the conventional drug doses. Hepatic impairment will cause the drug metabolism to slow down because there are a few enzyme molecules that work in the drug metabolism. Next, thank you.
Hello, my name is Evangelina Vincent Utamila Serda with student ID number 200251170. So in this moment, I will going to continue the presentation about antibiotic classes. There are several ways to classify antibiotics. Some of the most common are based on their molecular structure, spectrum of activity, and modes of action. Several classes of antibiotic are generally based on the molecular structure or chemical. There are beta-lactam, tetracycline, macrolide, quinolone, sulfonamide, aminoglycoside, known oxazolide, and glycopeptide. The antibiotic, if not used properly, will cause side effects that can lead to fatal things such as hepatotoxicity and nephrotoxicity. Next. Based on the table, there are several antibiotic classes that can cause nephrotoxicity and hepatotoxicity, or can cause one of them. So beta-lactam, sulfonamide, and aminoglycoside can cause nephrotoxicity, but in hepatotoxicity mechanism rarely happen. And tetracycline and chloramphenicol can cause hepatotoxicity, but in nephrotoxicity mechanism is rarely happen. In macrolide, nephrotoxicity and hepatotoxicity mechanism rarely happen. And then glycopeptide can cause nephrotoxicity, but in hepatotoxicity mechanism is rarely happen. And then ansamycin, in ansamycin, nephrotoxicity and hepatotoxicity, there are no recent studies. So we can say that the ansamicin are in nephrotoxicity and hepatotoxicity are rarely happen. And then quinolone can cause nephrotoxicity and hepatotoxicity. And then streptogramine is same with ansamicin. And then oxazolidinones can cause hepatotoxicity, but in nephrotoxicity, the case are rarely happen. And then the last one is lipopeptide. Lipopeptide can cause nephrotoxicity and hepatotoxicity. Next, thank you.
Okay, hello, this is Bernardo Tomorrow, student ID 200251178. So I will explain about the class of antibiotics related to hepatotoxicity, tetracycline part. Okay, so basically, tetracyclines are a class of wide-range antitoxins utilized in the administration and treatment of an assortment of irresistible infections. Antibiotic medication group as protein combination inhibitor. So basically, tetracycline, like tetracyclines, doxycyclines, and chlortetracyclines or minocycline follow up on the preserved arrangement of the 16S rRNA of the 30S ribosomal subunit and forestalled by the limiting of move RNA or tRNA to the A side of the ribosome with peptidyl tRNA, and furthermore, restrain protein combination by restricting to 23S rRNA of the 50 subunit. So tetracyclines are directed by means of oral course, while doxycycline and minocycline can be given either orally or intravenously. So the dosing of tetracyclines is distinctive in grown-ups and kids. Grown-ups may get 1 gram complete of antibiotic medication every day, which can be separated into 500 milligrams 2 times per day or 250 milligrams 4 times each day. For more extreme diseases, higher portions might be given, like 500 milligrams 4 times each day. So pediatric patients over 8 years of age can get a day by a day a proportion of 25 milligram per kilogram up to 50 milligram per kilogram, separated into 4 equivalent dosage. So high dosage of intravenous tetracycline can be inside fatty liver disease and may bring about severe hepatic dysfunction, acute liver failure, and death. This condition is more normal among pregnant ladies to a great extent during the last trimester of early post-pregnancy period. Notwithstanding, however, instances of acute fatty liver attributed to intravenous tetracycline have been accounted in non-pregnant ladies and in men and surprisingly in children. So this disorder is once in a while seen right now, as tetracycline is not at this point accessible in parenteral structure and the utilization of intravenous tetracyclines have been supplanted by accessibility for more secure, better endured, and more viable expansive range antibiotics. Next.
Okay, my name is Karima Maksuma-Dewi with student ID number 20025111189. I will continue the presentation about chlorampenicol, one of class of antibiotics related to hepatotoxicity. This drug indication for its use includes superficial eye infection or bacterial conjunctivitis and otitis externa. Chlorampenicol is a bacteriostatic by hindering protein synthesis. It forestalls protein chain extensions by restraining the peptidyl transferase actions of the bacterial ribosome. It explicitly ties to A2451 and A2452 deposit during the 23S ribosome RNA or of the 50S ribosomal subunit, forestalling peptides bond development. And proportion of patients with blood dyscrasias because of the chlorampenicol likewise grow. Clinically evidenced liver injury with jaundice, typically happening before the presence of aplastic anemia or extremely thrombocytopenia. That's all from me. Next, thank you.
Hello, so I will continue the presentation. My name is Niputulan Silujantara with my student ID number is 2002511173. So about fluoroquinolone is a broad-spectrum antibiotic and is widely used for therapy caused by respiratory infection, intra-abdominal infection, urinary tract infection, bone and joint infection, and skin and soft tissue infection. Ciprofloxacin is the third most widely used antibiotic for the fluoroquinolone class in Indonesia. Fluoroquinolone works by inhibiting topoisomerase 2 and 4 enzyme which function in the process of bacterial is for DNA replication. Ciprofloxacin and levofloxacin are the fluoroquinolone most used for today, but on the other hand, are most often associated with liver damage. Patients receiving ciprofloxacin, ofloxacin, and norfloxacin will usually experience small increase of 1 until 3% in liver enzyme levels. Meanwhile, related to the effects caused by levofloxacin, the effect has not been clearly found, but it is estimated that the effect is similar to other types of fluoroquinolone. In general, fluoroquinolone will have side effect in the form of indigestion, skin rash, headache, and allergic reaction. However, fluoroquinolone can cause more severe side effects, although they are less common, such as seizures, hallucination, angioedema, photosensitivity, and tendon rupture. Next.
Hello, my name is Made Kirana Chandra Hariputri with my student ID number is 200251168, and I'm going to continue the presentations about oxazolidinones. So oxazolidinones are a class of synthetic antibiotics recently approved for use. Until now, its mechanism of action is not fully understood, but oxazolidinones are said to interfere with protein synthesis by binding to the P sites of the 50S ribosome subunit. One type of antibiotics in the oxazolidinones class that is approved for use in clinical applications is linezolid. Linezolid is used in the treatment of skin and respiratory tract infections caused by gram-positive bacteria. Linezolid is often associated with cases of lactic acidosis that develop after 1 to 8 weeks of therapy. Lactic acidosis occurs due to liver mitochondrial dysfunction and injury, resulting in impaired liver functions. Liver mitochondrial damage will usually have more serious side effects, including peripheral neuropathy, serotonin syndrome, and pancreatitis, and kidney injury. So it can be concluded that linezolid causes lactic acidosis, which is a fatal effect. Next.
Hello, my name is Putu Arisa Pradeswari. I'm going to explain about lipopeptide. Daptomycin is a clinically useful lipopeptide antibiotic produced by Streptomyces rosetosporus. And secondly, hepatotoxicity on daptomycin, elevation in serum aminotransferase levels that occur in 2% until 6% of patients that receive daptomycin. Isolated case reports of possible liver injury from daptomycin have been reported, and serum bilirubin was normal in some cases. And there is serum aminotransferase elevation were mild to moderate and typically accompanied by either muscular injury with marked CK elevations. And the last one, a few cases have been reports of mild jaundice with a hepatocellular pattern of serum enzyme elevations and normal CK levels has been published. That's all. Thank you. I'm going to explain about beta-lactam. Beta-lactam is one of the enzyme groups produced by almost all gram-negative bacteria. Secondly, beta-lactams are so well recognized nephrotoxins. These bactericides inhibit the final step in bacterial wall synthesis. A recent observational study showed no significant increased risk of acne with prolonged infusions of beta-lactams are compared with an intermittent dosing strategy. And the last one, it is important to note that some beta-lactams, specifically the cephalosporins, cefoxtin, and cefazolin, interfere with an assay and can increase apparent creatinine concentration without causing kidney injury. That's all. Thank you.
Okay, the next one is sulfonamide. First of all, my name is Puturati Padmarini Gantarisari, and my student ID number is 20025111177. So, sulfonamide is an antibiotic class of drugs or class of drugs usually used to treat bacterial infections. The mechanism of action of sulfonamide is to inhibit PABA or P-aminobenzoic and the components of bacterium possessed by the combinations of trimethoprim and sulfametaxazole can decrease creatinine units and increase creatinine concentrations, inhibiting creatinine secretion from the tubules without creating any significant structure. And this reabsorption can cause hypercalcemia. That's all from me. Next.
So hello everyone, my name is Putri Tameswari with student ID number 200251102. And now I want to explain about the class of antibiotics related to nephrotoxicity. It's aminoglucoside. So aminoglucoside are a class of antibiotics that can also be used as antibacterial drugs that work optimally in anaerobic gram-negative bacteria. Aminoglucoside work in two phases. That's the first one is cause misreading of the genetic code which result in the end of mRNA translation, and the second one is cause the damage to the structure of the cytoplasmic structure due to the wrong protein insertion. So nephrotoxicity occurs as a result of the accumulation and retention of aminoglucoside in the proximal tubular cells. Okay, that's all from me. Next.
Okay, my name is Marikina Devis Avita. My student ID is 200251117, and I want to explain about glycopeptide. So, glycopeptide antibiotic, known as glycopeptide, prevent bacteria from forming cell walls by inhibiting peptidoglycan synthesis. Glycopeptide antibiotics have been linked to the following side effects: back pain, diarrhea, edema, flatulence, headache, infusion, reaction, vomiting, urine, breast, nausea, and vomiting. And vancomycin is one of the antibiotics used to treat infections by gram-positive bacteria, especially methicillin-resistant Staphylococcus aureus infections. Vancomycin can also be given in conditions such as cellulitis, pneumonia, endocarditis, and colitis. Side effects of vancomycin that may occur are the bitter mouth, nausea, vomiting, stomatitis, eosinophilia, interstitial nephritis, ototoxicity, kidney failure, skin rash, thrombocytopenia, vasculitis, erythematous hypotension on the face and body parts. So the last is polymyxin is antibiotic. Polymyxins B and E are used in the treatment of gram-negative bacterial infection. Gram-negative bacteria liposaccharides cause disruption in cell membrane stability, resulting in a bactericidal impact. Polymyxin has resurfaced as a potential therapeutic option in patients with multi-resistant pathogens. Next.
So, my name is Ida Kusari Basena. My student number ID is 202511184. So, quinones. The fluoroquinones are widely used for treatment of urinary, urinary tract, skin, and intra-abdominal infections. Fluoroquinones inhibit bacterial DNA synthesis. Explicitly describes side effects of fluoroquinones include acute kidney injury, or AKI, you can say. AKI has been really described in case report and recently in case study. Among all fluoroquinones, ciprofloxacin carries the highest risk of acute kidney injury, or AKI. The underlying mechanism of kidney injury seems to be primarily acute international nephritis, or AIM, with some cases showing that granulomatous international nephritis or crystal deposition when urine pH is greater than 6.8. Concomitant use of renin-angiotensin aldosterone increase significantly the risk of AKI. It has previously been reported that fluoroquinones could cause acute renal failure, or RF, after the ingestion of largest quantities, but it is now recognized that therapeutic doses of fluoroquinones can also cause renal injury. Next. The last one is lipopeptides, daptomycins. Daptomycins, a cyclic lipopeptide, exhibit rapid bacterial activity against gram-positive pathogens. Daptomycins is associated with mitotoxicity, increase the risk of rhabdomyolysis and AKI due to ATN. Recently, one case of AKI in the absence of rhabdomyolysis was reported. In a randomized trial, found that renal dysfunction at the end of treatment involved 11% of patients taking daptomycins versus 26% of patients taking standard treatment. Thank you.
My name is Agune Chaviranta with my student name number of 200250127. Now I'm going to sum up about the explanation of this student project. As we know, some drugs are metabolized in liver and excreted in renal. Certain diseases are known as predisposing factors for renal and hepatic impairment. Some of them often become main cause of ulceration in renal and liver. One of them is antibiotics. Antibiotics is widely used due to its efficacy and effectiveness against microbial infections. Among the 12 classes, antibiotics which induce hepatotoxicity include tetracyclines, chlorpenicol, quinolones, oxazolidinones, and lipopeptides. In addition, antibiotics that induce hepatotoxicity include beta-lactam antibiotics, sulfonamide, aminoglycosides, glycopeptides, quinolones, and lipopeptides. The consequences are that these antibiotics are highly prohibited in patients with renal and hepatic impairment. Besides, these antibiotics also needs to be administered with precautions to patients with renal or hepatic impairment due to the possibilities of that these antibiotics to induce damage on human renal or liver. This kind of knowledge is essential when prescribing drugs for special population with renal or hepatic failure. That's all from me. Next.
Okay, so that's all that we can explain about our student project assessment, and this is all the reference that we use for making our student project. And this is two. And last but not least, we hope the student project assessment give you a lot of information and more knowledge, and we close it with thank you.
Thank you.
Thank you.
Thank you.